of course, throughout the program, we have been discussing this global health crisis, the impact of the pandemic on the economy. And now we actually want to shift the focus, if we can, to its psychological effect on different populations. And to delve into this topic, I'd like to welcome to the program Cary Cooper. He's a professor of organisational psychology and health from the University of Manchester. Professor, thank you so much for being with us at this hour. Now, for many, this crisis is very much unprecedented. We've experienced and been witness to rising death tolls globally. We've been under lockdown for weeks on end. There is a spike in unemployment. Uncertainty certainly continues to reign. Might the mental health impact of this be long-lasting?
Well, it's certainly here at the moment. I mean, people obviously want the lockdown to go away, but the fear that they have of going into public transport and back into the work environment where they're supposed to social distance, but does the employer, have they sorted that out? Has public transport sorted it out? Should their kids be going to school? A lot of people don't want to send their kids to school. There is a psychological, mental health aspect of this. Aside from, obviously, the mental health aspects for people on the front line are enormous. And I anticipate a tsunami of what we call post-traumatic stress effects on frontline staff working in hospitals in all the countries that had large number of cases, certainly in the UK. But I think people are very reluctant. They want lockdown to go on the one hand, but they're very reluctant to expose themselves. And I think we've seen in Germany, now they've passed the reproduction rate for the infection, past 1. That's a problem. So people have returned in Germany, but now the figures are going up. And that reproduction rate is very significant. Incidentally, it's also past 1 in South Korea as well. So I think there's a lot of worry psychologically from a mental health perspective. I want to leave home. I want to get out there. I want to go to work. I want to go to shops. On the one hand, on the other hand, I don't want to be exposed. And I fear I'm going to be exposed, that it's a bit too early.
Professor, you mentioned a plethora of topics there. I want to delve into some of them. Interestingly, according to one study that I looked at earlier, there is a generational divide, a difference in how younger adults, so we're talking about 18 to 44-year-olds, thankfully I fall into that category, deal with this in comparison to adults 60 and older. Can you explain why that is?
Well, I think the data that comes out, the media exposure says when you're young, you're unlikely to have any very serious complications with it. And I think that message has been said a lot, and it's always focusing on older people and people in social care. And so there's been a kind of, and that's why I think in a way, the breaking of the lockdown a bit, certainly we've seen it in the UK, has been among younger people who, number one, don't think they're vulnerable, because this is an old people's disease, end quote, as I've had young people say it. And there's a real different divide here. There's also an ethnic minority problem, too, because a high proportion of deaths have been in an ethnic minority, among the ethnic minority population. We don't know why yet. I think the scientists are looking at the genetic implications or the sociological implications of family life among that group of ethnic minorities. And so there's a whole load of a lot of science we don't know, a lot of social science we don't know about this.
Professor, I'm going to have to interrupt you there because we don't have a great deal of time left, and I want to get through a few more questions with you if it's possible. If you can tell us a little bit more briefly, you mentioned children in this equation, and reportedly 99% have been living under some sort of pandemic-related limit on movement. 1.5 billion children out of school. Can you tell us again more briefly a little bit about the impact that this is having?
Well, I mean, at the moment, I don't think the impact is that bad in the sense from an educational point of view. I think kids are worried about it. They don't quite understand it. And again, it depends what age kids you're talking about. But I notice that my grandchildren keep saying to me something like, "This will go away, won't they, Granddad?" And this is a 7-8-year-old. "It will go away and you'll be able to come down and see me, won't you, in London?" So I think there is a concern. It's very difficult because obviously parents don't want to scare the kids, and they don't know how to contextualize it. And they don't know how to exactly explain to them what this is all about and that they have nothing to worry about. And so they tend to either ignore it or say there's nothing to worry about, yet they continue to hear, because they're very multimedia, aren't they, kids now? And they keep hearing stories and hearing about people dying, and I think it is quite disturbing to quite a lot of kids.
Absolutely. And lastly, I wanted to know if you might have any tips for our viewers on how to cope with these really high levels of anxiety, especially as, let's say in France, for example, today is the first day that we are, not us, because we've been coming to work, but many people are emerging from their houses, perhaps going back to work, and it's a lot to deal with, isn't it?
Yeah, I think really they have to do several things. I mean, the social distancing, I don't like that term. Let's call it physical distancing, but keeping socially connected to people. So number one, definitely continue to do that. Do not let go of that, because that really would be very problematic if you did. That's one aspect of it. Keeping socially connected psychologically is very important. People are social animals. They've been suffering being locked away for such a long period of time and only seeing people virtually. So now they have the opportunity to see people more. Stay away from them from that point of view, but connect with them, whether it's by virtual social media formats or when you see them at a distance. I think we can do that. I think that's really, really quite significant. And, be reasonably positive, but don't think this is over. There could easily and likely to be a second wave, and therefore we have to be extremely cautious. Just be patient. We're not a very patient society anymore. We lead frenetic lives, so it's important that we're patient.
Indeed, very wise words there from Cary Cooper of the University of Manchester. Be patient and do remember, of course, this is not the end of the pandemic. According to experts, a second, stronger wave potentially is expected. Thank you so much for being with us at this hour.